In this case, we're going to discuss mating-induced endometritis, a very common reproductive abnormality in broodmares. So in this particular case, a 24-year-old quarter horse mare presented to the clinic in mid-February, and the goal by the owner was artificial insemination of the mare and embryo transfer. Even though the mare was older, she had given birth the previous July and had been left open intentionally, and the owner wanted one more foal out of this mare. The reproductive exam was performed. The perineal area revealed a recessed rectum, and the dorsal aspect of the vulva was tilted somewhat forward, and there was poor muscular tone to the vulva. So an initial management procedure was to perform a Caslick to limit bacterial contamination of the upper part of the reproductive tract. An ultrasound examination was performed, and the mare was in estrus. She did have a large follicle on one ovary. She had moderate uterine edema, and there was no fluid present in the uterine lumen. Once that follicle attained a diameter of 40 millimeters, semen was ordered. It was going to be cooled, shipped semen. And then once we got the confirmation that the semen had been collected and was shipped, we administered the GnRH agonist deslorelin, brand name is Sucremate. And semen arrived on schedule the next day. The mare was inseminated. Sperm motility was 77% total, 71% progressive, again, sperm motility. The next day, the mare had not ovulated yet. There was a moderate amount of edema present, but we did notice that there was fluid in the uterus. There was echogenic fluid, along with some pockets of air. Now, the air, we can see as the bright white echoes here on this ultrasound image. That's from the insemination, and the fluid, this cloudy fluid that's in her uterus, was from the inflammation induced by the presence of spermatozoa. We did, for a teaching effort, we did collect a cytology sample from that mare, and there was a large number of inflammatory cells that are visible here on this cytology slide. A lot of background debris, and even a few spermatozoa were visible. For treatment, we lavaged out the mare's uterus with 3 liters of lactated ringer solution. We did administer oxytocin, 1 mil, which is 20 units, as an intramuscular injection in this particular case, near the end of the uterine lavage. It administered a few other doses throughout the rest of the day. At the end of the lavage, the uterus was examined again by ultrasound and was noted to be free of fluid. We did administer dexamethasone to this mare, 30 milligrams, as an intravenous administration to limit further inflammation. The follow-up exam the next day, the mare had ovulated. There was a little bit of non-echogenic fluid in the uterine lumen, and we did administer 4 more doses of oxytocin throughout the following day. The goal of the oxytocin treatment was to stimulate further uterine contractions and keep the mare from reaccumulating fluid in her uterus. And on the lower ultrasound exam, we can see this is her uterus, a little bit of edema present here, and just a very small amount of fluid, non-echogenic looking fluid here, again, in the uterine lumen. 7 days post-ovulation, we performed a uterine lavage and did collect a small embryo, a 236 micron early blastocyst, a grade 1 embryo, and transferred that into a recipient mare. Then after that, we did put in a temporary Caslick with staples, and then reopened that for the next estrus cycle, and we were able to collect embryos on 2 of the next 3 estrus cycles from this mare. As a review, all mares develop a transient inflammatory response after breeding, and it's clearly exposure of the uterus to spermatozoa, and it's not a response against the semen extender or the seminal plasma. White blood cells are generally present in the uterus beginning as early as 30 minutes after any breeding, whether that's live cover or artificial insemination. The inflammatory response peaks some 8 to 12 hours after mating, and in normal mares, that generally goes away by 24 to 36 hours. And the exam the next day typically reveals no evidence that an inflammatory response had even happened. However, in some mares, the inflammatory response may persist, and that does lead to lower fertility potential. You can recognize this clinically by ultrasound the day after breeding by the presence of a moderate amount of echogenic or inflammatory fluid, as evidenced here in this ultrasound photo. We'll have a video here of mating-induced endometritis. We're looking at the mare's uterus, now up on her left ovary, fresh ovulation here. Coming down her left uterine horn, some edema. Over to the right ovary, moderate follicles, and now back to the uterus, what we're going to focus on, and this moderate amount of echogenic or cloudy fluid in the uterine lumen. As we go back down toward the uterine body, we'll see this. Most of the fluid was at the base of the uterine horns. We try to characterize the fluid both in volume and in consistency so that if more than one person is doing the ultrasound exams, that we all have the same scale. And from the amount of fluid present, the scale is either no fluid, a trace, small, medium, large, or very large volume of fluid. And you can see here what this is associated with in the depth of fluid as visible on ultrasound. The fluid quality, the ultrasound characteristics, if it's non-echogenic fluid or relatively clear, it's given a code of 4. Slightly echogenic, moderately echogenic, and very echogenic fluid have different codes as well. Mating-induced endometritis is associated with a reduction in fertility potential, and that's if the inflammatory fluid remains present in the uterus beyond 48 hours. And again, mating-induced endometritis is not necessarily associated with an infection. It may be, but not necessarily so. It could be just inflammation without the presence of either bacteria or fungal organisms. And in a lot of mares, like the mare in this clinical case, the mare appeared normal until she was inseminated, and then she had this moderate inflammatory reaction. What is well known is mares with a history of mating-induced endometritis are at very high risk of repeating that on subsequent breedings. It's been estimated that approximately 15% of thoroughbred mares and about 12% of quarter horse mares develop persistent mating-induced endometritis after insemination or a live cover breeding. It does have a higher incidence rate in older mares versus younger mares. And again, the incidence rate increases in mares with a previous history of mating-induced endometritis. And in many mares, there is an increased risk when using frozen semen because seminal plasma, which is not present in frozen semen, it has a modulating effect on the inflammatory response. And with no seminal plasma, mares that are sensitized will typically have a greater inflammatory response than using fresh or cooled semen. The general management plan, if you know in advance the mare is likely to have mating-induced endometritis, is monitor the estrous cycle closely, induce a timed ovulation with either HCG or desloreline, breed the mare only one time if possible, and if you know in advance, you can administer corticosteroids like dexamethasone at the time of breeding. Lavage the uterus 4 to 6 hours after breeding to clear out all the dead sperm, the start of the inflammatory response, and any debris that's still present in the uterus. One can administer oxytocin or prostaglandins to stimulate uterine contraction and help with fluid removal. Oxytocin generally induces uterine contractions for 30 to 45 minutes. Prostaglandins may induce uterine contractions for 2 to 4 hours. The asterisk by the prostaglandin is to remind myself to note that prostaglandin should not be given after a mare ovulates because it will inhibit normal formation of the corpus luteum. We recommend ultrasounding the mare at the end of any uterine lavage, and that's to confirm that all the fluid has been removed from the uterine lumen. And if you check the mare the next day, if she's got fluid in her uterus, you know that that's fluid that she has secreted into her uterus and not fluid that you had left there from the previous lavage. Take-home messages in this case is mating-induced endometritis is very common in brood mares. The incidence increases with mare age. Mares that exhibit mating endometritis on one cycle are likely to exhibit it again on subsequent cycles, and preventive strategies, as we've discussed, a uterine lavage 4 to 6 hours after insemination, administration of oxytocin to promote uterine contractions, and possibly administration of dexamethasone at the time of insemination or breeding. If you want additional information on this case or other cases, you can look at the website of the Equine Reproduction Laboratory at Colorado State University.